Welcome back. I have a question for you. Does reading your medical bills or insurance coverage feel like you're reading something in a different language sometimes? The answer is yes. It's important to understand your healthcare costs, and now there is help thanks to UnitedHealthcare. Today, Executive Director for the Mid-South region, Christine O'Brien, is here with some good information about reading those healthcare costs. Thank you for talking about this because I'm mad. We were talking about how I had the flu a while back. Didn't pay my copay because I didn't need to pay one, but then I get a bill in the mail. I said, what is this? And look, it is important that we really understand what reading our healthcare costs looks like, because at the end of the day, the costs are going up, Christine.
They are. So, I think we'd all agree on a couple of things. One, healthcare cost is very expensive. Two is when we seek care, we want quality care and affordable care, right? And then three, how do we know? How do we know what's affordable and the quality and the cost of care? Well, I'll talk a little bit about the Surest product that we're offering at UnitedHealthcare. First thing we do is we completely eliminate the deductible.
Okay, amen to that.
Yes, the deductible is a barrier to care a lot of times because people have that deductible and won't seek care. It's a copay only plan. And the copay is determined by the higher quality, lower cost, more affordable providers have a lower copay compared to those that are lesser quality or higher cost. You are finding that information on an app on your phone. Search of what type of care you need, and they'll give you the list of providers and their copay. And that's all you pay. No bill in the mail after, no surprise bill. It's just one set copay for that one visit.
And you see it up front. When you go to the doctor, you already know what you are paying, because I was so surprised when I got this bill in the mail. I was like, dang, I should have gave them the wrong address. You know what I'm saying? Because I was just so surprised. Of course I paid it, good American, right? But I was so surprised. So again, it's called the Surest plan, something that you all are doing, which is great. But also we need to look at what does our employer offer, right?
Right. So through the Surest plan, the cost to the employer is about 15% less than a traditional plan. And for an employee, for someone like you seeking care, using the app and the Surest plan, your cost could go down about 50% compared to a traditional plan.
Come on, everyone.
Yes, so it's important to look at the different products that are being offered and evaluate that when you go through your open enrollment period.
And it's so important that we look at healthcare, because I want to show you all a statistic from the America's Health Rankings. In 2024, 11.5% of Louisiana adults avoided healthcare last year because of cost the previous year. It totally makes sense. But we also need to understand, when you're reading your healthcare coverage plan, there are some financial incentives. There are some wellness programs as well. I really need to look at my plan, because what are some of the options that maybe you all offer that I don't even realize that you have?
Right, so there's a lot of what we call hidden benefits that you may not be aware of. There are, we call them UHC rewards. So if you go to a primary care physician for a wellness visit, if you complete a health risk assessment, if you walk a certain amount of steps, you get dollars. You could earn up to $300 a year just by doing some of these services.
Money in my pocket.
In your pocket.
Just going and taking care of my health.
Yes.
Come on, we like a good reward. Now, we're talking, of course, medical here, but it's also important to note dental and vision as well we need to think about.
It's very important. Medical obviously is very important, but it's important that you, when you're looking at your benefits, you consider a dental plan or a vision plan or even a supplemental health plan, which is an accident type of plan, hospital indemnity plan that will pay you for certain services. But dental and vision are both very important plans. As you said, it's important that you're able to see and have healthy teeth. Yes, definitely.
And we were surprised, both me and you were talking about this before we got started, that teledentistry is a thing now?
Right. It is. It started during COVID, and it's something that is available on some plans.
So like, say you have a toothache, you can't make it to the dentist, you can do a telehealth appointment, and maybe they can prescribe you what you need to help with the toothache. Come on, 2025. And remember, we have to let everybody know. I don't want you all to go run the UHC after this to try to apply for this. When it comes to the Surest plan, when it comes to really any health care program that you all offer, we have to wait to the open enrollment period, right?
Correct, yes.
And that's October?
Yes. So for most companies, they re-enroll in January, but it really depends on the particular company and when their coverage renews. But most people renew in January, and that's in the October-November timeframe.
Some great information. If you're with
Yes.
UnitedHealthcare, the Surest plan may be an option for you. Christine, so good
Thanks,
to see you, my
Malik.
darling. Thank you so
Appreciate
much
it.
for being here. Look, everybody, for more information and for additional tips and resources, log on to uhc.com. All right, stick with us, everybody. We'll be right back with more Great Day, Louisiana.